Hi, I'm Dr. Hesch, a physical therapist from the Hesch Institute in Aurora, Colorado, and we specialize in treating complex cases of sacroiliac joint dysfunction. And my purpose is to briefly compare and contrast two biomechanical models of sacroiliac joint and pelvic movement dysfunction. And one model is from the book titled The Secret Cause of Low Back Pain by Vicki Sims, PT, and contributions by David Mesnick, PT, and that's a 95-page book directed at patients. And my book is titled Treating Sacroiliac Joint Dysfunction and Lumbopelvic Pathomechanics, Integrating the Sacroiliac, Pelvis, Lumbar Spine, Hips, and Symphysis Pubis. And this is a 290-page book, and I'll just show a couple of pages through it. All right, so I've separated the comparison between what's in these two books by 4 categories that are used to describe movement of the pelvis. And one is described as movement of the ilium, and the other is movement of the sacrum, and then movement of the pubic joint, and then movement of the entire pelvis as an integrated whole. I submit that the sacroiliac joint is a complex structure with a large number of patterns of movement dysfunction. And in the Sims book, she covers the types of sacroiliac joint dysfunction, and she covers that on page 26 and page 27, and covers the corrections for these patterns on pages 31 to 36. And in my book, there's a table of contents, and it begins at page 127, and I cover evaluation and treatment. Some of the evaluations prior to this page, and that's page 127 through page 228, and it shows patterns of SIJD evaluation and the corrections. In the Sims model, which is based on somewhat on the traditional model of SIJD, she covers 7 patterns, which is ilium upslip with posterior rotation, upslip with anterior rotation of the ilium, anterior rotation, posterior rotation, inflare and outflare. In the Hesch model, we cover that also, so we cover those 7, but we cover an additional 7 patterns, which are named type 2 inflare, type 2 outflare, downslip ilium, a very important pattern of dysfunction, oblique downslip, oblique upslip, side bent ilium, and pelvic side glide pattern. And my process of discovering additional patterns of motion dysfunction and developing corrections for that came from doing more palpation throughout the bony pelvis and testing ligament tone and developing passive movement tests, which are not part of the Sims model or the traditional model. And that's what led me to discover these 7 additional types of ilium dysfunction and develop a self-treatment for that. So these patterns are unique to the Hesch method. And then in terms of the pubic joint, the traditional and the Sims model recognizes pubic upslip and pubic downslip, anterior rotation of the upper pubic bone, posterior rotation of the upper pubic bone. And what I found that the anterior and posterior rotation of the upper pubic bone is actually a misnomer for a pure glide. So even though the landmarks may appear asymmetrical side to side, if you were to add palpation of the middle and lower joint, as is done in the Hesch method, you would discover that that is actually a pure glide pattern, and it requires a different and prolonged treatment because it's a very strong joint. So we negate those 2 types of dysfunction, but add a posterior glide, anterior glide, a lower pubic rotation, and a posterior fibrocartilage, and also acknowledge pubic symphyseal diastasis or pubic joint dysfunction with a joint space widening of 10 millimeters or less. So that's an additional 6 patterns at the pubic joint. And then the Sims model and the model of the sacrum acknowledges left rotation of the sacrum and right rotation of the sacrum. And the Hesch sacral model recognizes those two as well, but also recognizes the left on left sacral torsion, left on right, right on right, and right on left sacral torsion. Also a superior glide fixation, a forward bent fixation, a backward bent fixation, a posterior glide fixation of the sacrum, an anterior glide fixation, and also a right or left side bent fixation for a total of 10 additional patterns at the sacrum. And then I describe a lower pelvic pattern posteriorly, and it's not a part of the traditional model to evaluate the lower landmarks except underneath the sit bone. And I'm speaking of palpating the flat part of the ischium and also medial to the ischium. And so there is no lower pelvic model in the traditional model or in the Sims model. And in the Hesch model there are 4 patterns, which I name lateral ischium, medial ischium, internally rotated ischium, and externally rotated ischium. And of course the ischium bone doesn't rotate by itself, it's part of the hemipelvis. The point being that if you check upper landmarks and upper mobility tests, you will not encounter that pattern, but only by testing the lower pelvic landmarks and doing passive spring recoil tests, which I developed, will you encounter this pattern. And so that's a total of 4. And in conclusions, the 2 models have been contrasted and compared and have some similarities, and the Hesch model acknowledges a larger number of positional and movement dysfunctions of the ilium, sacrum, pubic joint, and lower pelvis. And I hope this has been informative to you, and I hope that it's been a very objective comparison and contrast, and I thank you very much.